Good evening, everyone, and welcome to my collaboration and leadership reflection video for Nursing 4010, Leading People, Processes, and Organizations in Interprofessional Practice. My name is Megan Groening. During this video, I plan to reflect on interdisciplinary collaboration experiencing, noticing ways in which it was successful and unsuccessful in achieving desired outcomes. Identify how poor collaboration can result in inefficient management of human and financial resources supported by evidence from the literature. Identify best practice leadership strategies from the literature, which would improve an interdisciplinary team's ability to achieve its goals. Identify best practice interdisciplinary collaboration strategies to help a team to achieve its goals and work more effectively together. I'll make mention of authors from the literature as well. Collaboration and leadership reflection. Mental illness is one of the primary disorders affecting Americans across all the states. Helping the ever-increasing number of patients requires all stakeholders' cooperation, from medical experts to friends and family members. Morley and Cashel, 2017. Through collaboration, medical facilities can offer quality customer services, establish and maintain suitable working environments, and collaboratively achieve organizational goals. Morley and Cashel, 2017. Having worked at my facility center for several years, I believe we can collaborate if leaders reflect on their past experiences and search for relevant or different strategies when making decisions. Notably, the facility developed a program requiring all the departments to work together, which I believe is essential for nursing managers. Reflection on my interdisciplinary collaboration experience. As a result of an increasing number of mental illness cases in our locality, my facility developed the Family Network program that sought to bring together all parties in helping patients with mental disorders. It was designed to help friends and family members discover their role in supporting mental illness patients. Morley and Cashel, 2017. The hospital management worked to reduce hospital admissions because patients were diagnosed in their homes through medical experts and caregivers. Research conducted on patients indicated that most of them could not seek help due to stigmatism. The initiative was originated to enable the community to appreciate patients and motivate them to seek necessary aid. With the funding from both the state and federal governments, the project was meant to help address mental illness in the community, mainly due to drug abuse. The nursing managers tasked all medical experts from all departments to take part in the program. They included nurses, doctors, nutritionists, social workers, pharmacists, occupational therapists, psychologists, and psychiatrists. As a psychiatric nurse, I was tasked with patient care plans by closely developing their treatment plan and recovery goals. It was my duty to continuously follow up on patients to interpret their healing process and be in a position to offer necessary aid. Other health experts, for instance, nutritionists offered the best food options for patients. Every group member had to help with patients in their specialization, and after a day's work, we were required to comply by reporting our field activities. The program was successful because from our medical records of inpatient and outpatient admissions, there was a significant decrease in numbers. It also effectively tackled stigmatism based on patient interviews. Caregivers also improved service delivery after receiving the necessary training from medical experts. On the contrary, we witnessed significant shortcomings. For example, there was no full participation of all the group members affecting implementation. Additionally, we lacked enough financial resources to approach all patients in need. Top nursing managers suggested that the program could have been successful if all the stakeholders collaborated and received necessary training. Further, the hospital and other financiers could have provided enough financial resources to allow group members to reach all patients. Results of poor collaboration in management of human and financial resources. The Family Network project faced hurdles because the managers did not apply the necessary approaches in coordinating financial and human resources, medical workers, and caregivers. Notably, in implementing the initiative, there was a lack of cooperation among some group members due to poor communication. Coordinating group activities require effective communication from top managers to all group members. Some members complained that they did not receive enough instructions while in the field. In some cases, it was not easy to pass information to the culturally diverse villages. Decreased productivity was witnessed due to a lack of motivation for healthcare workers in the field. Even though resources were limited, there were cases of misuse of finance by some nursing managers by taking part in activities not scheduled and could not account for resources. As a result of poor coordination of human and financial resources, the group could not achieve some set objectives. Our target was to reach 1,000 patients in a week, but as a result, we only managed to access 700. Communication challenges resulted because some patients and caregivers could not interpret the message. Employee relationships also deteriorated because of misunderstandings during the community mental health tour. Misuse of funds donated by the state and federal government affected our future perspective of getting grants. Best practice leadership strategies to improve service delivery of interdisciplinary teams. Some of the noted failures were a result of poor leadership in group activities. Coordinating multidisciplinary team calls for the right communication strategies to enhance information sharing. Since group members were drawn from different departments, it was necessary to offer all group members training services to align them to project objectives. Because it was our first community program, it was required to encourage members to appreciate patients from diverse cultures. Decreased productivity and frustration could have been averted if our leaders displayed team management, communication skills, efficient decision-making, problem-solving, and ability to delegate. Successful managers are those willing to accept challenges, search for new ideas, and work closely with their juniors. Best practice interdisciplinary collaboration strategies to help the team achieve set goals. Drawing people from diverse departments requires application of the best team collaboration approaches. Applying the latest technological tools, for instance, in communication, will ensure that the team stays in contact. For example, Microsoft uses Teams to allow instant messages or holding online group meetings. Working in multidisciplinary teams requires motivating social interaction, sharing of knowledge, insights, and resources. Since members are from different sectors, sharing reading materials, for instance books, will ensure that all members receive vital data. Allowing friendly social interactions among the group members and the patients is a critical factor in offering quality services. Another relevant approach is creating a suitable environment for open communication. This allows members to share ideas and be able to challenge ideas shared by their colleagues. Open communication enables nursing managers to determine real-time events from the group activities through online chats. Finally, the team will achieve interdisciplinary collaboration by incorporating team-building skills and activities such as encouraging group members to participate in games after the fieldwork. Conclusion. Interdisciplinary collaboration is essential for any healthcare center to achieve the set goals and objectives. Indeed, this calls for professionals across an organization to work together. In our case, we came together to facilitate the Family Network Initiative, which sought to involve all stakeholders in helping people with mental disorders. Even though we managed to achieve some of our goals, we experienced drawback due to poor financial and human resource management. The process could have been successful if nursing managers applied necessary leadership strategies such as proper communication and motivation. Further, applying the best collaboration strategies such as knowledge, sharing, and motivating team building activities could have overseen some of the shortcomings. My references are listed in the document attached, and thank you so much and have a good night.